good about diet and exercise, but the pounds still aren't moving or you continue to gain weight, it might be time to have your hormones checked. They can play a vital role in how your metabolism works or doesn't work. Here to weigh in on how to finally get the body you want from the inside out, please welcome Dr. Drshelenalaljiesthetics from Dr. Shel Wellness and Medical Spa and Diane Cartwright, who participated in the weight loss program.
Yes.
Good morning.
Good morning. Great to be here.
Okay. We now know so much more about how the body deals with calories in, calories out,
Absolutely.
and all of the factors. Because I know years ago people would say, no, really, I'm eating right, I'm exercising.
Right.
And we're like, sure you are. It must be a glandular problem.
Yes.
Well, they weren't so far off.
No, they weren't. So, you know, there are so many different things that go into managing our weight as well as losing our weight. It could be your thyroid, which is so underdiagnosed in today's society, in today's medical world. Exactly. Or hormonal imbalance that can start in your 30s and go into your 60s and 70s, into menopause, of course. It could be your lack of nutrients. It could be your stress, so your cortisol hormones. So lots of different things that play into it, as well as your genetics, of course.
Right. You deal with overall wellness, but
Absolutely.
as a trained doctor, you were OBGYN.
I'm an OBGYN.
So you see the patients coming in all the time going,
oh, they're exhausted, they're not sleeping, they are just no drive, no motivation, losing hair, gaining weight, so many things going
Your
on with
husband
their
looks
gut.
at you and you're like, get away from me?
Yes, exactly. Not to mention the irritability and anxiety. Absolutely.
Like, is there someone else?
Yes.
No, I can't even handle you. Why would I want somebody else? Okay, so Diane, all the things that she was saying, you were just nodding your head, nodding your head.
Definitely. Every symptom she was explaining is what I had been going through. Now, over 10 years ago, I had a partial thyroidectomy, so I only have half a thyroid. But the doctors that I kept seeing kept saying, oh, no, your thyroid level is normal. Well, how could it be normal when you only have half a thyroid?
Yeah.
And so as I got older, my symptoms started getting worse until recently, as I started getting older, I started having fatigue, just exhausted. I started gaining weight. I had mood swings, anxiety, and panic attacks.
And you had no
constant.
real explanation for it.
No explanation. And not only that, I couldn't sleep at night. I kept waking up. I started getting acne, and of course, like I said, the weight gain. I was miserable, and even brain fog. I couldn't think straight, and my husband's like, who is this person?
I am right there with you.
Yeah.
And I had the same situation, and of course, I would go to some doctors, and they would say, okay, let's break it down. I'm going to give you an antidepressant for your mood. I'm going to give you this to wake you up. We're going to give you Adderall.
5 different medications to deal with different symptoms, and that's what Diane was going through.
Yeah, as opposed to hitting on the cause.
The cause, which is your hormonal imbalance. And so when Diane came in, go ahead, Diane.
Well, when I went to see Dr. Shel, the doctors had already put me, also my blood pressure was high, and I don't have high blood pressure. So they
your
put me
body
on,
was laboring.
Exactly. And so I was just desperate. I needed some help. I needed answers, and I wasn't getting them. So when I went to see Dr. Shel, she ran some blood tests and a saliva test, and she said, it is your thyroid. It's not only your thyroid, it's your hormones, it's your cortisol level, your adrenals, everything. And she
because it's like a domino effect.
It is.
Exactly.
But I want to touch on something she said when she said, they said that it's normal. Okay, it's normal for this kind of ambiguous test.
Yes,
but if you have these symptoms, obviously it's not normal for you.
Exactly.
And that's what you got to look at.
You have to listen to your body. So what I always tell patients is be your own advocate. If you think something is wrong with you, make sure that the doctors are running a detailed analysis of your thyroid, which is 5 different tests rather than just a TSH, and getting you in the optimal range rather than the range where you're alive.
Yeah.
You want to be
or the
feeling great.
The range where the insurance covers you or not.
So, exactly.
Okay. So you lost 25 pounds.
Yes.
And so let's go through different ways you did this. One, of course, is balancing hormones.
Yes.
The other is, okay, so when you balance the hormones, you level the playing field. So now whatever you're doing right actually counts for
works.
you. Yeah.
Exactly.
Okay, you also have HCG.
Yes, so the HCG weight loss program is a program in which you actually use the hormone, and it's a natural hormone that is made in our placentas when we're pregnant. And you use this hormone so that, and what this hormone does, and we've known this since the 1950s from the Simeon's protocol, it actually uses your own fat for energy. Right. So you don't eat many calories, but you eat the right foods, no fat, no
so it's not wasting your muscle,
foods.
it goes to the fat.
You're not losing muscle, you're only losing fat. And our average patients in a 40-day cycle lose 15 to 30 pounds.
Wow. Okay. And let me say this. Ever since this came out, you have all kinds of things either over the counter or buying off the internet somewhere that claim that they're HCG.
Yes,
you have to do it this way to make sure you know what you're getting.
Exactly.
With the
Under a doctor's supervision. as far as that goes, and no online products because you want to get it from a specialty compounding pharmacy, which is regulated.
Yeah, regulated and made just for you. And you got to know what you're putting in your body. Oh, the other thing is after you lose the weight, it's like, okay, I lost the weight, but there are certain stubborn areas that genetically we can't exercise away.
We cannot exercise away. We all have these areas, whether it's your belly, your love handles, your bra folds, your thighs, your arms. And those are the areas that you can address with a procedure called cool sculpting. Cool sculpting is non-invasive, non-surgical, and FDA cleared to actually destroy or kill these fat cells. What we want to do is when we lose weight, we're actually reducing the size of the fat cells and then they grow back. But with this Harvard-based technology, what we're doing is we're actually taking away those fat cells from your body permanently.
So it's fairly weak. So when you freeze those areas, it just basically sends a message to that fat cell that we've been damaged, exit the system.
Exactly. And your lymphatics clear it out, and over the next few weeks, you actually have the abdomen that you want, you have the love handles gone, and you have the arms and thighs that you want.
Once again, girl, you look good. Bahamas, right? Okay, now let's talk about the reaction skin treatment.
Yes, so the reaction skin treatments is great because if you want to do a little sculpting, so you have lumps and bumps, which we do, and then you have cellulite. Cellulite is a huge problem because there really isn't any great technology for it until Reaction came out. It's by a company called Viora, and it uses radiofrequency technology with vacuum so that it breaks up all that cellulite and really gets your lymphatics to get rid of it. So the cellulite is gone with about 8 to 10 treatments, and it's non-invasive, non-surgical. Both of these procedures, lunchtime procedures, go right back to work or your kids, and you're looking good.
And you're going to come back over the summer a whole new person.
Absolutely.
Dr. Shel has a special offer only for Great Day Houston viewers. You can get a free consultation and up to 25% off all aesthetic laser treatments, weight loss programs, and bioidentical hormone packages. To take advantage of this special offer, you must call by noon today. At least just call by noon to get your appointment set. 281-313-SHEL, and Shel is S-H-E-L, 1L. 281-313-SHEL. That works out to be 281-313-7435. You can also log on to drshel.com. So you lost the 25 pounds, but how do you feel today?
I feel wonderful. I have energy. I feel great. And now that I've lost the weight, I look forward to trying her other techniques, which is a cool sculpting.
Well, that's what makes a great day. We'll be right back.